The Dallas County Sheriff's deputy taken in to be screened for Ebola is back home tonight. State Health Department test results for Sergeant Michael Monig came back today negative for the deadly disease. Test results from the CDC are expected to come in tomorrow. With his release, we finally know how he ended up at a Frisco Care Now facility that set off a two-day ordeal that really captured the entire nation's attention. Fox 4's Phil Alvarado spoke with Monig's wife tonight, who says she never thought her husband had Ebola.
Steve, and she says that apparently some health officials didn't either because they told her husband to go to his private doctor. Tonight, Sergeant Monig's wife says he's enjoying some peace and quiet finally, and some football.
Sergeant Michael Monig is home tonight, safe and content to know he is not another Ebola patient in North Texas. After a harrowing 2 days, the Ebola test came back negative.
It is exactly what we thought it was, and it's nothing. He's okay.
Last Wednesday, Monig entered the apartment where Dallas Ebola patient Thomas Duncan had been staying. He looked around at Duncan's family, quarantined in the apartment. He later told his wife he saw the faces of some very scared people.
He did actually call me Wednesday to let me know that, what was going on, and just to calm my nerves in case I heard anything.
Lisa Monig says her husband also told her he saw signs that someone had been sick, but he touched nothing and no one.
When he came on Wednesday night, and we were pretty okay, understanding he really couldn't get it with airborne contact. When they quarantined his squad the next day, we had some concern.
That's when the Monigs requested a meeting with county health officials and were assured there was no risk to the family. Yesterday, while out of town on business, Lisa Monig got another call from her husband, asking if she felt all right.
I said I was feeling fine, and that's when he said that he was not feeling well, and he had headache, was fatigued, and had some stomach pains, and was kind of concerned since those are possible symptoms of Ebola.
Sergeant Monig called Dallas County Medical Director Dr. Christopher Perkins as he had been instructed. He was told to go to his personal doctor or to an urgent care clinic.
He contacted our primary care physician, who was booked and was not able to work him in, and that's when he went to Care Now.
The world's attention was once again focused on Dallas as an ambulance carried Monig away from the Care Now clinic to Texas Health Presbyterian Hospital in Dallas with the highest levels of precautions against another possible case of Ebola.
There's a lot of fear out there, but Ebola is not a new disease. It's just new to America. We know a lot about it, and our first responders are being taken care of, and they're all safe.
Dallas County Judge Clay Jenkins had also been in Duncan's apartment at the Ivy Complex without protective clothing and says he feels safe from the Ebola virus.
I hate that his family worried about this.
Now, the Monigs also have a 15-year-old son who goes to the Colony High School. He was kept out of school today at the school's request. The family says they were fine with that, but he will go back to school. And by the way, the school never saw any need to close because of this. As for the Care Now Clinic, it was scrubbed down today and expected to open tomorrow. Steve?
All right, Phil, so you said Dr. Perkins, the county medical director, told him to go to his primary care physician or a clinic. Did he just not have the big vision here of what might transpire once he walked into a Care Now and said, I've been around an Ebola patient or in an Ebola patient's apartment?
Well, I think we have more to learn about this, and right now we're hearing what the family says are the instructions that they got. But I think you've got a couple of things at work here, because County Judge Clay Jenkins says that he's not surprised by the negative results. He says that he knew that Sergeant Monig had a 0% chance of having this virus. So if you go by the science and the symptoms, you would tell someone to go see their doctor. But emergency medical personnel have some very strict criteria to follow, and when you check off one of those boxes, then that's when everybody goes into action. You see the scenario you had yesterday, and everyone has to err on the side of an abundance of caution.
Right. Makes sense. As soon as he mentioned he was in that apartment, I think just the whole thing started happening. It was triggered, right? Phil Alvarado, thank you very much.